Hello, and we are live. Happy Wednesday. It's hump day. Happy hump day, everybody. It is March 13th. It's my sister's birthday. And it's also hump day. March 13th is also the third day of Ramadan. So there's a lot of cool things happening. And it's also still the month of where we celebrate women. And it's also what we just passed is the International Women's Day. So, I mean, it's a lot of big things that are happening this month. And today is the episode 55 on Discover with Spinati. What are we going to talk about? Today, we're going to be talking about what are those three big things that happen in dentistry that most people don't really know too much about, but are very curious about them. They are dental implants, dental veneers, and yes, you guessed it, clear aligners. I know that's what you were thinking, and that's why I said it, because I'm telepathically trying to guess what you have in your mind. So, as I was saying, today is day 55, and we're talking about dental veneers, dental implants, and clear aligners. That's what we're going to talk about. It is going to be a quick and short one. I know I've been saying this for the past few days, and I've gone way over time. My aim is 10 minutes, so let's get crack-a-lackin', shall we? This is it. What are dental veneers? What happens to the teeth under the veneers? How long do they last? And of course, the most asked question when it comes to veneers, what do they cost? Let's get rolling, people. Let's get rolling. What are dental veneers? Dental veneers are, as you see on the screen, they are thin shells, very thin shells that you put on top of your teeth after the dentist removes a tiny bit of your teeth. Yes, a little bit of your teeth are removed with dental veneers, whether you're getting porcelain veneers or whether you're getting non-porcelain veneers, whether you're getting composite veneers or whether you're getting porcelain veneers, there is a little bit of tooth structure that is removed. It must be removed in order for things not to look bulky. You have to understand, if your tooth is in a position where it needs to actually be reduced, it doesn't matter what you put on. And furthermore, here's something that you probably didn't know, that if your tooth is discolored and you want to change the color with veneers, if you're putting composite veneers, you need more tooth structure to be removed than you would with porcelain veneers. And so that's why it's actually more advantageous for you, if you're trying to preserve your teeth, if you're trying to not destroy your teeth, for you to actually get porcelain veneers rather than composite veneers. What are composite veneers? Very good question, my friend. Let me tell you. Composite veneers are the filling material that we use. Let me repeat, the filling material that we use to cover the teeth so that they can look nicer. Now, I can tell you one thing, is that the far majority of all the veneers out there, the ones that look nice, are porcelain. The ones that are not so much, they're composite. So it depends what you want. If you want really nice, you can get the porcelain. Now, what else are these things? Now, in terms of what porcelain veneers are, they are, if you think of them in terms of something that looks like a contact lens, that they're supposed to be that thin. Really, they're supposed to be incredibly thin. And so the amount of tooth structure that is removed is very, very small. And so after you remove that small piece of tooth material, the majority of it is enamel. And so the actual porcelain veneer actually stays on enamel. And the bond, let me tell you something about the bond strength, like the glue, the amount of force required to remove the veneer from the tooth. My goodness, it takes hours. It takes a long time to remove veneers, especially when they're bonded properly. It literally becomes part of your tooth, except it's a very nice part of your tooth. Okay, so then when you're smiling, it's unquestionable how nice your smile is. All right, now, how are we doing with time? My goodness, I have to speed up. Okay. What happens to teeth under the veneers? Now, as you can see here in this image, you can see that there is a little bit of tooth structure that's removed, and you can see that the veneer is put on top. But the amount of tooth structure that's removed is incredibly low. So if you want to see the margin there, you can kind of see the margin a little bit. And the margin is where you can see that the gum is, where it contacts the tooth. That's that margin, that little dip there. It looks like a little bit of a ditch. That tells you the amount of tooth structure that's actually removed. It is so minimal. It is so minimal that placing the veneer on top and bonding it properly, it will last you for a long time. So what happens to the teeth under the veneers? If it's an actual veneer, what happens to your teeth under the veneers, if it's an actual veneer, is that literally almost nothing except for the removal of a little bit of enamel. But other than that, veneers are the most conservative cosmetic option that you can do, period. And the most long-lasting cosmetic procedure that you can do if it's done well out of any other cosmetic procedure that you would do. Veneers are the longest lasting. And so that's why if you were to compare the price of this kind of cosmetic procedure versus other kind of cosmetic procedures, it is incredibly good in terms of the investment that you would have to make for you to have such a beautiful smile. Okay. How long do they last? Well, I kind of alluded to it. They last around, let me remove this beautiful picture. How long do veneers last? Veneers last around 15 years to 20 years, sometimes even more, depending on certain factors. And there are certain factors that actually determine, one of which is your habits. So if you chew on pens or ice cubes or whatever, obviously the veneers are not going to last that long. If you brush your teeth and your gums too hard, your gums are going to recede. Now, one thing that is not really talked about too much is something called your gingival biotype, or your biotype for short. And your biotype is how thin your gums are. Some people have very thick gums. It's just genetics. Now, if you have thin gums are more susceptible to receding over time. The thick gums are less susceptible. So if you have thick gums, if you're blessed with thick gums and you put veneers on, then more than likely veneers are going to last longer than if you had thin biotype, if you had very thin gums. The reason is because of the recession. So if the gums recede, then now your bone's going to be a little bit exposed. Your bone's going to recede a little bit. So then now you're going to have a veneer that doesn't look as good. So that's why you're probably going to be needing to remake it. But on average, veneers do last around 15 to 20 years. Okay. All right. Now, how much do they cost? The $1 million question. How much do veneers cost? Now, let me tell you something. With veneers, it really depends. Actually, with anything, it really depends. If you go to Mercedes and you buy a Mercedes, you're going to pay more than if you were to go to Kia and get a Kia. Okay? No offense to Kias. But they're both cars. They both get you from A to B, but don't tell me they drive the same, and don't tell me they last the same, and don't tell me that they look the same. The prestige associated with an amazingly looking car is different than the one associated with a not so good looking car. Now, here's the thing. Here's the kicker. You're putting that thing on your face. So the thing with the car, you can go cheaper with the car because you're going to be parking it. More than likely, you're not going to be driving it for a long period of time. And you're going to go from A to B. Maybe you're going to drive it for 10 minutes a day, 20 minutes a day, 30 minutes a day, if that. And that's it. But you're actually wearing your teeth, your veneers. You're wearing them 24/7. No matter what you do, they're on your face. You can't remove them and put them to the side and be like, all right, I put them later. So, whenever I'm going to go out for, a date night or whatever, I'm going to put them on. No, they're on your teeth forever. And so that's why you want to invest in your teeth. You want the teeth, your veneers, to actually look incredibly amazing. Because if they don't look amazing, then you're going to be covering your mouth when you realize your teeth don't look good. That defeats the whole purpose of you getting veneers. And if you want to remake the veneers, it's a nightmare for you and it's a nightmare for the dentist. So make sure that you know the investment is worth it. And if I were you, I don't know about you, but if I were you, I would pay a little bit more to make sure that these teeth, the veneers, are actually going to be ones that I'm going to be incredibly proud to show off, as opposed to ones where like, oh, they're okay, but I got a good deal, whatever that means. Okay, so the cost of the veneers. Now that I've covered all of that, the cost of veneers, they range between, according to my knowledge, in London, Ontario, they range between $1,600 and $3,700. Yes, it's a big range, okay? Because you get some people that will charge you that cost and some people that will charge you a lot more. It depends on their experience, on their level of confidence, on their, what they can deliver, the type of lab that they have. Like, it really has a lot of factors to play into it. Okay. And also depends on how difficult it is in terms of getting you the results that you want with the starting point that you have. And it is 10 minutes, people. It is 10 minutes. I really wanted to cover the rest today, but I'm not going to have time because I want to stop at 10 minutes. And I said to you guys that I wanted to stop at 10 minutes. So we're going to stop there. Tomorrow, I'm going to continue this. I guess it's going to be a 3-part series. Now, this part is the what are dental veneers. Tomorrow, I'm going to cover what are dental implants. And the day after that, I'm going to cover what are clear aligners. And I'm going to cover the 4 most asked questions with regards to each one of those. But as you can see during my podcast, I also throw in some more questions that patients have asked me or I've researched. And so I give you a little bit more than you have bargained for. And that's what you get with Dr. Spinati. I hope you're doing well. Make sure you stay well and make sure you tune in tomorrow to learn more about dental implants. Always keep smiling. Good night. Okay, wait. We got a question. I removed it from Instagram, but I just saw the question. It was just asked to me, people. Okay, I saw the question. Can I pay in monthly installments for veneers? What a beautiful question by a beautiful person. So, this question, can I pay monthly installments at Spinati Dentistry? You can. Absolutely. Okay, because we do have payment plans and it makes it incredibly affordable. I'm telling you that right now. And me personally, as the owner of Spinati Dentistry, I actually do that even with the things that I have to do a lot of things in order for you to get that payment installment, the payment installment. But yes, you can definitely get the veneers by doing monthly installments according to your own um, whatever you want to pay per month, because it doesn't go through us. It goes through us meaning Spinati Dentistry. It goes through a third party who then administers that payment plan. Okay, excellent question. I welcome all questions. Thank you so much. And again, I can't even talk. And again, stay tuned for tomorrow, or rather, not stay tuned. Come back tomorrow for the second series, the second part of the series. I am honestly, I'm just going to stop right there. Come back tomorrow for dental implants. Keep smiling. Good night.